Dr. Ashwini, if you could kindly talk about how does chronic infections impact or cause diabetes, and explain a bit about this phenomenon.
Right. So I think first of all we need to understand what is these chronic infections. Most of the time, if you don't get a fever, you don't think that you have an infection. So if after meal you get bloating, if your intestines makes a lot of gas, if at night you get hungry, or you always feel feverish, or in between these periods of in the day, then you feel a little feverish. So these are some of the symptoms that you can think about, that you have some level of chronic infections going on in your body. Now, this could be fungal infection, this could be parasitic infection, this could be bacterial, this could also be viral infections. Now, all this, if we have good bacteria, good microbiome in our body, it consumes the food, turns into something good for us. But if we have pathogenic microbes, it uses that food, turns into something which is toxic to our body. And this is called endotoxemia. Now, chronic infections in the gut, consuming the food, producing a lot of endotoxemia, lot of toxins going into the system. That system gets impacted by that. Liver can be impacted. Also the mitochondria at the end of the day, which is impacted by this endotoxemia. Now, when your mitochondria is not functioning well, this is where your sugars will go high. So you see, chronic infections, consuming the food, turning into the waste, going to the mitochondria, impacting the mitochondria, thereby metabolic health is becoming a challenge, thereby blood sugars going high. This is the connection of chronic problems leading to diabetes. Now, how do you know? How do you test that? One simple practice, you look at your CBC. In the CBC, if your lymphocytes are more than the range, if your eosinophils are high, if your neutrophils are low, there's some of the markers you can, just a very simple report you can see, or you can test yourself with the organic acid testing, where we can get specific metabolites of some of these chronic infections. We can also do gut microbiome testing, where we look at the genetic makeup of a lot of the microbiota. Could be parasites, could be fungal, could be viral, could be also bacterial, different species of these microbes. So GI map is one of the tests that can give you a lot of information that you have chronic infections, and as you fix these chronic infections, your metabolism will improve. As a consequence, you will have better sugars in your blood.